In these couple of days here, we're trying to figure out what the call for action is for the industry in terms of adopting and accelerating health interoperability standards. So I think one key thing we have learned and discussed is the fact that the change will come from new small and medium enterprises, and the role of all the stakeholders is to enable that. Governments to make sure that the market itself will accept smaller medium enterprises that are entering the market with innovation, with new solutions, with something that has not been procured before. The clinical community must engage in order to provide content and define the content that it needs to do its job. The patients have to be offered compelling services which help them to take care of their health. And the insurance companies, the payers, of course, must also enable this innovation in order to bring the cost of treatment down and to, of course, improve the health of its insurees. Most current large projects are being given to large corporations that are the incumbent players in the market. These players are known for something called sustaining innovation, which means that they add functionality to existing products and try to keep the status quo without disrupting. So a new form of innovation is what we call disruptive innovation. This comes always from the small companies, from the bottom of the food chain, who are providing cheaper solutions, much more innovative, not as capable as the established player in the beginning, but slowly moving up as the requirements change. Now, these are the players which we can count on, especially in Europe, since all of the big players are from the US. We can count on them to provide solutions that will change the face of healthcare technology. In order for them to compete against the big players, they need support. But more than that, they need health information standards, semantic interoperability standards, which allow then a customer to take a best of breed of these innovative solutions and produce an integrated system to compete with the big vendors. The way we are treating patients, we will need to keep this data for the lifetime of the patient. This absolutely ensures we will be switching applications during this life cycle, and in the process, either migrating or losing a lot of the data. So what we need to do is to decouple the data platform from the applications in a way where many vendors of applications can use the same platforms. This ensures interoperability, but it also opens up the market for new, smaller vendors who do not have to produce the whole stack, but just a solution on top of a data platform. And what I would like to see is government and the EU solving the problem of involving clinicians to define data models once and for all. Because the situation today is that each, for instance, EU project defines their own data models. Semantic HealthNet is no different. Unfortunately, once the project is finished, these models are not used in the next projects. And this creates a lot of waste, but more important than that, it really stifles innovation because somebody could already use the existing IP.
I think on the long term, semantic interoperability is very important and will even become more important. In the move towards integrated care, where a patient is followed really from the beginning through his whole life, and where all the data captured needs to be interpreted and communicated to all the people and systems that are taking care of the patient or the citizen, then semantic interoperability is becoming very important. I think one of the challenges more on the long term is to also adapt the financing system. I think if you look at the financing system today in healthcare, basically today most of healthcare systems are based on a fee-for-service. And a fee-for-service is, I don't say it's a bad thing, but it will focus management of a certain service to focus on the productivity of that particular service and less on integrating it into the complete care chain. So I think there is an issue to transform healthcare towards a financing which is more based on outcomes and clinical outcomes. Because of course, if the financing is based on clinical outcomes, then as a manager of a service, you really focus on being well integrated into the whole system to provide these optimal outcomes. I think we don't have to be too negative. There are a lot of standards and there is already a lot of semantic interoperability available. So the glass is half full. We're not there yet, but there is already something. And I think we need to leverage on that. I think there is a lot of work which is done. There are a lot of institutions there with which we can leverage to move to a better semantic interoperability. So I don't think we need to focus on yet another standard and yet other organizations or institutions that need to be added, but more like picking the best parts and the best bits which are existing today, find out where the gaps are and really fill these gaps so that we can move forward more in a better way. Now, for that, I also don't think there is need to really build a big new institution, but I think with all the stakeholders involved, there are already groups where some kind of governance of this can be done and where those gaps can be identified and can be commissioned to standards developing organizations to fill those gaps. And I think it is important that all the stakeholders are involved. We see that adoption is also a major issue in adoption of interoperability. And for that, I think you do not only need the authorities and the scientists put together, but you also need to involve the clinicians and the industry, because they also are the ones who will need to adopt the standard.
I think there's been a lot of good work done trying to connect healthcare systems, trying to get the data out of the silos. But in many ways, I mean, these standards, which are part of the whole process, are not perfect, as people who have developed them are not perfect. And we will never come to the full perfection of just plug and play interoperability. So I think people also have to manage the expectations. But really the key challenge is, why do we need it in the first place? And I think the answer would be different for different segments. So probably public health authorities would need to get the data out of the systems for different reasons than perhaps the patients or a cardiac surgeon. So as long as I think we don't really nail the right question, it's going to be difficult to find the right answer. What we should analyze is the business model of care delivery, who needs what is the job to be done, as the disruptive innovation theory says, and then try to go back to the drawing board and see what would be the right solution for the job to be done. It's not going to be easy. I think there are many ways of people needing to let go of the legacy. Many standards that we try to adopt in terms of the semantic interoperability are just not going to cut it. I mean, they're not going to take us to the end that we needed. And I think we need to be provocative ourselves. I mean, there may be solutions out there which we just don't see, which are already doing the job that needs to be done. Like, again, the examples of the mobile health, examples of the social networks, examples of applications like patientslikeme.com, where 300,000 people are in the network, which perhaps is getting the job done without anything that we are discussing in the large-scale implementation. So back to the basics, I think the whole model needs to be defined in terms of what are we trying to do, and for what the semantic comparability may be the solution for. And I think if we are really honest, we may be actually very surprised what kind of answers we get to the questions that we ask.